Today we'll be discussing some facts about diabetes. First, is diabetes or diabetes mellitus a familial disease? Diabetes mellitus is a complex disease that is characterized by persistent high levels of sugars or persistent hyperglycemia. Broadly, diabetes is classified into two types: type 1 diabetes, type 2 diabetes. Type 1 diabetes is generally seen at an early age of life or in childhood. It is an autoimmune disease wherein the immune system of the body attacks the healthy cells of an individual. Whereas type 2 diabetes mellitus is seen at a later stage of life, generally in 40s and 50s of life. It is caused by either deficiency of insulin, or this decreased release of insulin from the pancreas, or insulin resistance. By insulin resistance, I mean that the amount of available insulin does not reach the target tissues. Genetic factors make some individuals vulnerable for diabetes. On the top of genetic factors, other factors like diet, physical activity, environment, stress, they add upon and result an individual into developing diabetes mellitus. We'll be discussing now regarding diabetes and pregnancy. Some women, for the first time, are diagnosed with diabetes during pregnancy. This is called as gestational diabetes. This is different from females who are pregnant and they have been having diabetes before pregnancy. But what is most important, whether gestational diabetes or pregnant patients with diabetes before only, all can have a healthy pregnancy and a healthy baby. What they need to do is, they need to get in touch with their gynecologist and they need to follow up regularly with an endocrinologist. They should enroll themselves into diabetes education program. Pregnancy and diabetes is a very important aspect, and it is a very crucial moment. It needs to be handled in a very nice way and a very proper way, because little blood sugars getting fluctuated here and there can result into congenital anomalies in the baby. Strict control of blood sugars during pregnancy, is very important. Mostly patients, those who are pregnant and they have diabetes, that is gestational diabetes, they are treated with insulin during the pregnancy for better outcome. We'll discuss regarding living healthy with diabetes. Many people have a perception that once they are diabetic, that is the end of everything in their life. But that is not the real thing. Healthy lifestyle can help to prevent or delay in the onset of problems associated with diabetes. There are very important factors that if somebody takes proper care, they can have a very healthy life being diabetic. We'll discuss them one by one. First and the most important is diet. An individual with diabetes should be very careful about diet. He should restrict carbohydrate intake to the maximum. More consumption of vegetables, fruits, vegetables and fibers should be included in the diet. Coming down to physical activity. Some form of physical activity daily is very important. 20 to 30 minutes of brisk walking 5 days in a week, jogging, getting involved into some outdoor sport activities daily is again very helpful, or going to the gym is again one other form of physical activity. Doing yoga, meditation, reducing the stress to bare minimum, regular intake of prescribed medication by the treating doctor and good compliance with medication, adequate sleep, good physical activity and regular follow-up with doctors at regular interval will all help in leading to a healthy life with diabetes. we'll discuss regarding hypoglycemia. Hypoglycemia means low blood sugar levels. It can be seen in both patients, type 1 diabetes and type 2 diabetes. It is a dreadful complication seen in patients those who have diabetes. What is hypoglycemia? When the blood glucose levels in the blood they drop down to less than 70 milligram per deciliter, we call a patient having hypoglycemia. What are the warning symptoms of hypoglycemia? A patient starts feeling dizzy, this feeling of lightheadedness, perspiration, dryness of mouth, nervousness, feeling of jitteriness, transient blackout, feeling very weak and exhausted. These are all the symptoms of hypoglycemia. Now, once these symptoms are there, how to diagnose hypoglycemia? If there is a glucometer machine available around, immediately one should check the blood sugar levels and document it. If they are less than 70 milligram per deciliter or around 70 to 80, patient should be immediately treated with some form of glucose to be given immediately. Now, this should be given in the form of either sugar solution, sugar lollipops, sugar cubes, some fruit juices. Once the patient starts feeling little better, after 15 minutes again one should check the blood sugars, that whether the sugars blood sugar levels have increased or they are still on the lower side. If they continue to remain on the lower side, another 15 to 20 grams of carbohydrates should be administered to the patient. Lastly, we should look into what is the cause of hypoglycemia and should treat it.